Exercise is felt to be across the board for the majority of pregnant patients, both just recreational as well as athletes, felt to be a very safe thing for pregnant women. The biggest benefit of exercise during pregnancy would continue to be the aerobic aspect of it from a cardiovascular standpoint. Circulation, cardiac benefit, respiratory benefit, this is all wonderful in non-pregnant as well as pregnancy. But second biggest benefit, I think, is that they continue to be more limber. They continue to be, they feel better. Comments frequently heard from patients who are exercising are that as the pregnancy progresses, they really do feel like their stamina is decreasing. And I tried to warn them, but I try to encourage them also continue at a pace that's reasonable for them. I still think that the patient continuing her calisthenics and her stretching and her ability to do it so long as her comfort level is there is fabulous, because she's going to do better in labor. She's going to have a better experience the more limber she stays and the more comfortable she is with it. Something that always comes up that I tell the already working out athlete and the person who's already in a routine is they can check their pulse. You want to keep your pulse under 140, and it's generally been a rule not to get your heartbeat racing, because if you're racing your heartbeat faster than your baby's heartbeat, you're competing with oxygen with the baby. Second, more simple way is if you're working out and you're getting short of breath as you're working out, that's why I tell them they're overdoing it. Whether it's a treadmill, an elliptical, an exercise routine, walking, biking, anything. If they're short of breath during the exercise, that's where I tell them to draw the line. They've got to back off to a comfort level with their routine. The question addresses a very good topic of that is the people that suffered with first trimester illness related to the pregnancy that then bounce back second and third trimester. And I often think that many of those patients can get back into an exercise routine when they're feeling better. And it's the perfect time for them too as well. Second and third trimester, they all bounce back to a degree where I say they'll rebound even with their energy level, and they'll start to feel like they can do things. And it is a great time to get back into things that they physically feel they're able to do. So they've not lost anything if they did that. If they were slower, if they were taking it easy during first trimester, they can always get back into some routine. But I tell them to begin at about 50% of what they were doing and work up to whatever they feel is comfortable for themselves and their bodies, and listen to their bodies when they get back into it at that point. A testament to a good experience at the hospital is certainly that I've had all three of my own children. My wife obviously delivered three beautiful children at the hospital that are all grown now, but the experience was just something to experience, and all with the greatest nurses and the greatest care, anesthesia, nursing, postpartum, and I wouldn't have had it any other way, wouldn't have gone anywhere else. And the experience, it was to this day the best days of our life. My wife would probably speak to the same given the opportunity.